Hospitals in Halifax have reached a critical point.
I'm worried and I'm a bit upset that we've rocked our apple cart of so little COVID for so long.
This ICU doctor says they currently have 6 COVID patients intubated, and for this province, that's a big deal.
In all of the first wave, we had a total of 8 intubated COVID patients over the span of the several weeks and months of the first wave.
I'm not trying to scare people, but I need to be blunt. This situation is very serious.
This weekend's huge numbers are part of a backlog as the province works to process tens of thousands of lab tests. But this scene is a key part of Nova Scotia's strategy as the fight unfolds. People lined up to get a rapid test with no symptoms and no reason to believe they've been exposed.
We've been testing almost between 3 and 5% of the Halifax regional municipality area several days in a row, each day.
As of Wednesday, more than 33,000 people were tested this way during the current outbreak. 75 have been positive. But Barrett says the numbers are not what's most important. Even if one of these people tests positive, that's one person then isolating and not walking around in the community, potentially infecting so many more.
We have the highest per capita rate of testing in the country.
Rapid testing is driven entirely by volunteers.
You can put people on the moon. You can probably figure out how to teach someone to put a swab towards the back of someone's nose without calling it a liability, a problem, or an impossibility. So those are what I would call really poor excuses.
As hundreds step up to volunteer, 27 people were ticketed $2,000 each this weekend for violating lockdown regulations. It flies in the face of thousands lining up to get tested.
Public service, it's my second test. The rest of the world can really learn from what we're doing.
Health officials call it a movement, one more tool in a complex fight. Kayla Hounsell, CBC News, Halifax.